Now what we're going to do is to actually apply some soft tissue work, mainly to the plantar aspect of the plantar fascia. So it's mainly getting into this section here. So what we basically do is make sure you've got your gel, and so we can start to work into there. So we're going along the course of the plantar fascia, but even though I'm coming up to the insertion point, which is in this section here, I'm not going to come deep into there. The main areas that I'm working on is more the plantar fascia and the flexor digitorum brevis and the adductor hallucis muscle, which I'm going to actually work into here. So all I'm basically going to do is to just work along those. I'm using this part of my hand here to actually get in and make sure I can actually get into that part of the foot. So I just cup the rest of the foot with my hand. So once I've done that, I can use my thumb and start to work my way down along the course of the fascia. But also make sure you work along the adductor hallucis. So again, you start to work into this section here, because this is where you've got 3 trigger points that actually sit, 1, 2, 3, which will actually sit along that particular muscle. So make sure you work into that. You can flex the digit back, and again that muscle will become a little bit more prominent. So just work your way into there. Once you've done that, keep it flexed, and then you can start to come into the trigger point. You can apply pressure. Once that's been deactivated, move on to your next trigger point. Whichever one's most tender is where you apply your pressure, hold it, deactivate those trigger point. Same again, once you're working underneath this section, what you're going to basically do now is just come to the distal end of the heel, and this is where you're going to have your trigger point for your quadratus plantae. Your quadratus plantae tends to span in this direction, attaches to your flexor digitorum longus tendons, which will then expand down here. So again, flex the toes back, come onto your quadratus plantae, and what you're going to basically do now is just apply pressure to that and then hold that. Okay, once that starts to be relieved, then you can start to release, but that generally is going to radiate pain over it in this particular direction. Coming down from here is you're going to work into more the deeper structures. You palpate into here, which is more your kidney 1, and you'll generally find that's going to be tender. Just coming more slightly proximal to that, again this area is going to be tender. So again, you can apply pressure, hold it, again 30 seconds to a minute. Again, ask the patient to let you know when it starts to ease off. Get them to take a deep breath and then relieve, and then same again, hold it for about 30 seconds and then ask them to relieve. Normally after you've done that, and you've done these ones down here, if you go back to the insertion point, in many cases you'll find you're palpating to there again, and that can significantly reduce the amount of pain and discomfort they're actually feeling in that particular area. So that's just more your soft tissue work that you're going to actually apply. Apply it to the calf to start with, deactivate trigger points in the calf, come down into the foot, do your soft tissue work into the foot, deactivate your trigger points, and then you can go on to any needling or mobilization techniques that you can start to add in to the actual treatment protocol, depending as to what the patient's actually presenting with and what the main signs and symptoms are and what your primary diagnosis is.